When we get sick, life can be inconvenient. But when kids get sick, it's a whole new ballgame. And that's the purpose for the existence of Lehigh Valley Reilly Children's Hospital, providing a place for kids to be kids while they're still getting the treatment that they so desperately need. So why a children's hospital? What are the differences between children's health care and the health care that we adults get? And what is the outlook for kids at Lehigh Valley Reilly Children's? And how can parents help their kids to a healthier and better future? That's the conversation today as we're joined by Baum and Dr. Nathan Hagstrom of the Lehigh Valley Reilly Children's Hospital. And that's all coming up right here, right now. My name is Chen, and this is Face the Issues. Good evening and welcome to Face the Issues. I'm Chen. When kids get sick, it seems like the whole world grinds to a halt. And there's a lot of conversations about why kids get sick, why kids seem to get sick more than adults do, and is there a difference between how we treat kids and how we treat adults for what may sometimes seem like the same illness? Well, that's the purpose of the Lehigh Valley Reilly Children's Hospital, the Children's Hospital for Lehigh Valley Health Network in the Lehigh Valley region of Pennsylvania. And we're joined today by their president, Corley Baum, and their physician-in-chief, Dr. Nathan Hagstrom. Welcome to Face the Issues, and thank you so much for joining us.
Oh, thank you.
Thank you for having us.
Let me start the 30,000-foot question. We asked this in the intro, which is, I think sometimes, especially for people like me who are not in medicine, we think healthcare is healthcare. And so if an adult can get cancer, a kid can get cancer. An adult can get bronchitis, a kid can get bronchitis. An adult can have asthma, a kid can have asthma. And we treat illnesses. But the idea of a children's hospital suggests that we're not just treating illnesses, we're treating a patient, and that children are different than adults. So what is the purpose of having a children's hospital? LVHN has been around for a long time. Lehigh Valley Hospital has been around for a long time. Why a children's hospital?
Well, children are different. They're not little adults. Their physiology, their anatomy, how they respond to treatments and medications is different than adults.
And Ann, for you, I mean, you're the president of the Children's Hospital. You've been in healthcare for a while. Why come over to the pediatric side? And what drives you in that direction?
Well, the children are the future of our community. So working with children and their families to help them be as healthy and productive as possible and making sure that there's a safety net when they become ill is really important to the future of a community.
Yeah, I appreciate the way you put that. Means it's the future of our community. And also, Dr. Hagstrom, you said they're not just little adults. And I think a lot of times we think that way, especially for me as I became an adult and as I get older, I often think of kids, even younger people who are, younger as anyone who's younger than me. And I think, well, you're just smaller versions or younger versions of adults. Is the approach different at Reilly Children's Hospital than at the rest of LVHN? How you approach your patients different than if you were approaching an adult patient with the same condition?
Yeah, children's hospitals are much different in how they approach care, not just how they deliver the care and what care they're delivering. It is all different because children get different diseases. Mm-hmm. And they do respond differently to treatments, even if it is the same disease. You're also going to be much more careful about such things as diagnostics. Just doing blood work on a child takes more effort and causes more trauma for the child than it would necessarily an adult. X-rays, other diagnostics, just doing an MRI, some children can't sit that long and would need sedation. So your approach to diagnostics is different, just like your approach to treatment is different.
That was my case as a child. I was a patient at Children's Hospital of Philadelphia. Reilly's wasn't a thing at that point. And for me, it started with trying to go to LVH for MRIs and just not being able to as a young child, to deal with, I was slightly claustrophobic, and then to deal with that. And I remember going to a children's hospital and even going through trainings of how do you go through a machine and things like that. Dr. Hagstrom, you brought up an interesting point about just we think about, okay, there's a different psychological approach to this. There's perhaps a different bedside manner. But you said even the treatments for what may be the same disease might be different between adults and kids. Could you expand on that a bit?
Sure. Some medication doses are going to be different.
Okay. Sure.
Even the frequency of administration, how you monitor their response is going to be different than an adult. There are some medications that we can use in adults that we can't use in children because they're still growing and developing. So there are definite differences in, even if it's the same disease, in how you approach managing it. But I will point out there are different diseases that we care for. For example, cancer. The types of cancers children get are much different.
And can you give us an example of and why do kids get certain kinds of cancers and adults get different kinds?
Adult cancer, of course, evolves over many years and typically involves the gastrointestinal tract and head and neck and areas that have been exposed to the environment or other toxins over many years. Children tend to get cancers that are more developmental. Okay. More genetic mistakes rather than exposures to toxins. That's why children's cancer is much less common because these genetic events that lead to their types of cancer are rare.
Sure, and I can imagine that would be for potentially other illnesses as well. I mean, the more we're exposed to things as we get older, the more likely we are to have certain conditions that somebody who's only been on the planet a few years might not have.
Correct.
I want to ask you about kids as they grow. Imagine then if as they're growing, the treatment is going to shift for them, right? I mean, as a kid, so this is a terrible analogy, but I always think of as a kid gets older and they get bigger, my parents had to buy me new shoes every year, right? It's like the worst part of childhood, they said. And so I imagine that also shifts treatment. And so as an adult, generally when I get treated for a condition, it's pretty much based on what the condition is, and it's not based on changing my body, changing me getting taller. Imagine that's going to be a massive shift for kids.
Correct, yeah. As children grow and develop, they not only get bigger, but their anatomy changes, and even down to the molecular biochemical level, their physiology changes. And you need to have experience with each age group to know how to approach their treatments and monitoring them and helping them through it.
I want to shift a little bit to the psychological side of it. One of the things you have at LVHN is the Child Life Program. Could you talk about the Child Life Program and what it is?
Yeah, Child Life Specialists are great. They truly are an important and integral part of the care that we provide. They not only help children understand what's happening in terms that are specific for their age or development, they also help them cope with varying techniques, even techniques that work for you and I, like distraction and music and play therapy. So they're wonderful. They're trained specifically to do that. So there isn't really anybody else who could do their job.
And let me ask you about that. I mean, again, you've been in healthcare, in different sectors of healthcare for a while. The Child Life Program, and when you think about it, and when you think about the role that Reilly's plays, what is it about that part of it that gets you most excited?
Well, it's what differentiated our facility from just a regular community hospital, that we have this extra dimension of care and concept of how we care for the child and their families, making sure that it's not just plain vanilla, but customized to each child to help them experience it as positively as possible when they're going through something difficult.
Yeah, and Dr. Hagstrom, last question in this segment. Toward that end of kids being different, and not just medically, but how we approach it is going to be different. This is a debate that I hear a lot, and not just with kids, with adults too. How important, as a doctor, how important is that bedside manner in the practice of medicine?
It's important throughout all age groups. Medicine is not just about diagnosing and treating. It's about relationships, making a connection, helping that person, child or adult, through their healthcare journey, and both good and bad times. So it's that bedside manner is just as important as the medicines we use.
Do you find that building that relationship or having that good bedside manner contributes to a patient's recovery or a patient's overall health care?
Absolutely. It improves their adherence to the treatment plan when they trust you, and to their follow-up appointments, et cetera. The most important thing, though, is that it provides hope, and I think hope really does help you be healthier.
That's a great word. We're going to cut the break. When we come back, I want to talk about just some of the conditions that you see at the hospital and how can parents help keep their kids healthy, especially as we enter this holiday season. And so don't go away. We'll be right back. Welcome back to Face the Issues, and Dr. Hagstrom, thank you again for joining us. I want to talk a little bit now about just the kinds of conditions that you see at Lehigh Valley Reilly Children's Hospital, and then also how parents can help keep their kids healthy. What are the conditions that you see the most at the Reilly Children's Hospital?
For the past few months, RSV bronchiolitis has been the most common reason for admission.
And what is RSV?
So RSV is a virus. It's a respiratory virus, very common one. It circulates every year. And it happens to infect not just your upper airway, but also your lower airways.
Okay.
And children have just smaller airways, and so any kind of inflammation and sort of mucus development, if you will, is going to have narrowing of the airways and therefore some difficulty with breathing.
And that would be, it's to your point in the last segment, that would be have a more significant impact on a kid and an adult because of the size of the airways?
Exactly right. So their anatomy and physiology has them affected by RSV bronchiolitis much different than adult.
Okay. And why, I mean, you said in the last few months, and we all know around this time of year when the holidays roll around, everyone says kids get sick more. I mean, usually I think it's just anecdotal evidence that, oh, well, you know, my kids are always getting sick. Is that actually true that kids tend to get sick more when they go back to school or when, around the holidays? And if it is, what's the cause for that?
Yeah, that's a great question. There's multiple reasons. For one, just as going back to school brings out the viruses, wintertime brings you indoors.
Okay.
And for the same reason, you just get closer contact, less air circulation, and more exposure. The other is sunlight actually can, if you will, sterilize surfaces. And not only are you playing outside more, but viruses don't stick around on surfaces as much as they would indoors. RSV, for example, loves to stay on a surface for hours, if not a day, whereas we've learned, the COVID virus doesn't last quite as long on surfaces. So its primary way of infection is sort of air droplets, whereas RSV is both contact and air.
Interesting. So it is true that as kids go back to school and as the weather gets colder, that illnesses tend to go up.
Yes, exactly, yeah.
Interesting. I want to ask you also about pediatric cancer, and there's a whole part of your hospital that deals with pediatric cancer. Is it common? I mean, you mentioned in the last segment that it's different, generally different kinds of cancers than what adults deal with. But is pediatric cancer something that's common that we see a lot of, or is it still considered pretty rare?
It's rare, much less common than adult cancers.
That's good to know. That's a good thing.
Yes, it is.
you have an entire center at Reilly Children's Hospital dedicated to this. One, why? Especially, some of them might say, why? Especially if it's so rare. And what does that center do? What's the approach there?
So pediatric cancer is rare, but our area is large enough that we see over 40 children newly diagnosed with cancer each year.
Oh, wow.
And we do partner with CHOP around rare cancers and advanced cancers. And CHOP is only 60 miles away, so that's a really important partnership for us. We provide chemotherapy both in the outpatient setting, as in our infusion center, but also in the inpatient setting in our pediatric unit. We provide child life specifically for children with cancer. We have social workers, nurse practitioners, physician's assistants, and we of course have our physicians, and all are specifically trained in pediatric cancer.
And so they're not just pediatricians, that is specifically what they work on.
Correct.
And I know last time we had you on, you were talking about the Pediatric Cancer Foundation, Lehigh Valley, and some of the partnership that they have with you guys. What is that like in your role at LVH and Reilly's, but also working with these other groups in trying to create awareness and also help the families of patients? What do you see when you sit down and talk to those families, or when you hear about them and you hear of these kids? What do you see? How hard is it for these families? I mean, we said it's not a lot of cases, but still 40 a year. There's 40 families a year in our area walking through that. What do you see from where you sit?
Well, it's not just the child, it's the whole family and their extended family, and managing through the treatment process and holding on to this challenge of finding hope and helping this child battle through to get to a positive result is really important to support. So PCFLV and other organizations around the Valley support families in this battle. And one of the key things that's critical for us having this location here is that children and families can stay closer to home for their treatment. And that makes a huge difference, that they can get their treatment right here locally, don't have to move to another area during that time. And that is really helpful for them managing the rest of their family in addition to the child that's sick.
Things that we don't always think about when it comes to somebody who's sick. Dr. Hagstrom, let me ask you this, two parts of this question. Let's go with the first part, which is, I think every parent, right, we hear this all the time, parents' greatest fear is hearing your kid has cancer. Is there anything that parents can do to help, I don't know if I want to say prevent or at least lower that chance? Or is it with pediatric cancer, so much of it is genetic that there's nothing a parent can really do to protect their kid from it?
Yeah, almost all pediatric cancer is either random genetic events that we can't prevent or control, or you have a genetic predisposition which we don't currently have treatment or a cure for that will, prevent the cancer. So honestly, there's really nothing that parents can do to prevent their child from getting cancer. Early detection can be important for many cancers, and so it's just being aware of your child and what symptoms they might have and getting medical attention when you're concerned.
Okay. Second part of that question, a lot of these other illnesses you brought up, RSV, things like that, I mean, the challenges of going back to school, these are things that you don't get cancer from germs on the table, but things like RSV or COVID-19 you can, or they're in the air. How do parents help? I mean, is their kids, you can't just pull your kid out of school or put them in a perpetual bubble. So how do parents help keep their kids healthy? Because you got to keep your kids healthy to keep your family healthy. How should they go about doing that? What advice do you have for parents about how they can keep their kids healthy?
Yeah, that's a great question. They're going to be exposed to viruses and other infectious agents. That's just part of life. And in fact, you almost want them to be exposed. For those viruses and other infectious agents that can be serious, for many of them we have vaccines. So vaccinations have really done a lot in the last 50 years to prevent serious illness from some of these infectious agents. So we encourage vaccination. As far as those at greatest risk, so infants and any child with a chronic disease, the prevention that we suggest is people who are sick, especially if they're acutely sick with a fever and a new cough, they should stay away. Good hand washing is always, something we encourage, whether it's Purell or soap and water. And then covering your mouth and nose when you're coughing or sneezing is always smart. I mean, these are simple things, but they do go a long way. But we aren't going to avoid, and maybe we don't really necessarily need to have all children avoid these infections. Most do quite well.
Dr. Hagstrom, and thank you for joining us. Thank you so much for all that you do for children in Lehigh Valley, and I know beyond. And so thank you so much for your time today.
Yeah, thank you.
Thank you.
Don't go away. We'll be right back. Welcome back to Face the Issues, and now I'm joined by MaKenna Boss, a young student who spent her own time and efforts to raise money for Lehigh Valley Reilly Children's Hospital, and she joins us now. MaKenna, welcome to Face the Issues.
Hi.
It's so glad that you're here. First of all, can you tell our viewers what grade you're in?
I'm in 8th grade.
Okay, and so you're about halfway through the 8th grade year, right?
Yes.
Okay, so you're a middle schooler. Tell us what you decided to do for the Lehigh Valley Reilly Children's Hospital.
A few years ago, when I was admitted there, Child Life had brought toys and crafts every day, and it made it less scary and a little less boring. So I asked my mom how they had gotten all these toys, and she said mostly through donations. So I knew I wanted to start helping and bringing toys and crafts to the hospital.
I love that. I mean, so you benefited from this, and then you want to give back. Yeah. And what did you decide to do? What kinds of things did you do?
I started off doing bracelets and keychains. Now I sell mostly baked goods.
Okay. And you're still doing this?
Yes.
Oh wow! So you're still selling, and so you bake them yourself, or you make the bracelets, and then you sell them, and that money goes to Lehigh Valley Reilly Children's.
Yes.
That is incredible. How long have you been doing this?
About 3 years now.
So you started this when you were probably like 10 years old then?
Yes.
And you've been doing it for 3 years.
Yes.
Let me ask you, where do you sell this, or who do you sell it to? Is it your friends, family, at school?
I have a Facebook page where I sell everything, and my friends and my family and local people can buy stuff from me.
So anyone can log on to that Facebook page and they can order something from you?
Yes.
And the proceeds go to Lehigh Valley Reilly Children's. MaKenna, let me ask you this. You're in middle school, and a lot of people will say to you, you should be having the time of your life, you should be playing with your friends. If you're going to start a business and raise money, you should be putting it in your college fund, or you should be saving it to buy a car in a few years when your parents let you drive. Why do this and raise all this money and then go and give it to a children's hospital? How do you answer that? What's your drive? What's your purpose?
I knew that those toys and crafts really helped when I was there to make it a little less scary and boring. So I knew I wanted to be able to help the other kids and help put a smile on their face when they're there.
Yeah. Again, I love that, and I just love how you were impacted, and then you decide to now go and impact others. Have you been able to meet any other kids who've been at Reilly Children's? No. Maybe one day. Let me ask you this then. You're in middle school. I know you've got friends who are your age and playmates and so on. What message do you have for other middle schoolers? Or somebody sees this or watches your interview here, What message do you have for other students, for young people like you, to encourage them to do the kind of stuff that you're doing? What message would you give them?
I think no matter how old or young you are, you can always help out in your community and find a good way to help someone and help put a smile on their face.
Yeah, I think that's a great message. And so is your plan to continue then to keep doing this?
Yes.
Okay. All right. Well, I appreciate what you're doing. I know our friends at Lehigh Valley Reilly Children's appreciate what you're doing. And it's just, you're such an inspiration, to be so young and to have this vision and this heart to give back. There's a lot of full-grown adults who don't do this and who don't understand the importance of giving back. And I just think you're setting a fantastic example. So thank you so much for doing that. And thank you for coming. I know you've been recognized by some incredible people. You were recognized in the Iron Pigs game. You've been recognized by Wawa and others, and it's very well deserved. And I appreciate you joining me and just talking about what you're doing.
You're welcome.
Well, thank you so much, MaKenna. And that is our show for tonight. I do want to thank Baum and Dr. Nathan Hagstrom for joining us. I want to thank the entire team at Reilly Children's Hospital for the work that they do day in and day out. And of course, to those physicians and nurses and everybody on staff at children's hospitals across the country. I just want to thank them for their tireless efforts. And of course, I want to thank MaKenna. What a fantastic example she is setting, not just for students her age, but for all of us. An example, an inspiration of what we can do for a community if we all do our part. I want to thank each of you for tuning in. We want to thank you for your continued support and your viewership. And on behalf of all of us here at Face the Issues, my name is Sam Chen. Thank you and good night.